Greetings, ladies and gentlemen. What an excitement for us to be connecting with you once again from Uganda. If you remember very well, we are the country that last hosted this conference in 2019. And we are back yet again, joining you, our brothers in Rwanda, and those that have come to join us from other countries. My name is Gerard Okiria. I'm a social worker from here in Uganda, and I serve on the National Association of Social Workers of Uganda board as the national treasurer, and I work with Compassion International, which I am very sure is expanding in more African countries. I am a chief editor of the Commonwealth Organization of Social Work. What an excitement is it for me to join you together with my other colleagues that will be making this presentation on behalf of the National Association of Social Workers of Uganda on what we have been doing during these 2 years of COVID pandemic. So at this moment, allow me to invite my brother, John Mary, to take us through the first session of our presentation. Over to you, John Mary.
Thanks very much, Gerard. Greetings from Kampala. I'm John Mary Sekati. I'm the National Coordinator of the National Association of Social Workers of Uganda. But also I serve on the International Federation of Social Work Occupational Therapy Committee, and also as an independent social worker for children and families across borders. We had an engagement during COVID-19, and our topic is on leveraging technology to support families, to support children, and also strengthen capacity of frontline social workers. You can see the presenters. I'm John Mary Sekate, Gerard Okiria, and our colleague Ben Sevuma, who will be coming later. We are representing NASU, and that is the layout of our presentation about NASU, project description, our motivation, our approach, advocacy interventions we made, and capacity building efforts, lessons we learned, and also recommendations. When you talk about NASU, NASU is a professional body which is mandated to promote social work and social development in Uganda. And we are a member of International Federation of Social Work and Global Social Workforce. And also we work with over 30 universities here in Uganda and over 50 social work agencies with a membership of about 7,908. NASU is led by an executive committee of 13 members with Michael Byamukama as our current president. And also NASU, we hosted the International Federation of Social Work Africa Conference 2019. That is, I think, enough for you to know about us. The project, of course, we intended to see that we continue working and supporting communities and promoting resilience and positive mechanism, mental health, resilience of children and families during COVID-19, but using technology. The project addressed the challenges of physical limitations that were imposed on gatherings, but also as a visible strategy to continue supporting vulnerable populations like children between July and January 2021. The project targeted early career professionals because they are mostly on social media, and also they have bigger network, and also worked with NGOs and government structures across the country. We realized that the old structures could not work, like anyone also realized that. And therefore we needed to harness technology and orient our services to address the needs of both existing and the millions of Ugandans that suddenly had been thrown into turmoil by the virus. Our motivation was to dispel fear, myth, stigma in the population, but also we wanted also to change the perception that COVID-19 was a medical issue, because for us we believe, yes, it is one part a medical issue, but it is largely a social, behavioral, psychosocial that require social work intervention models. But also we had a desire to save our vulnerable groups like the children, the affected and infected, and also to support frontline social workers to continue working remotely in different parts of the country. but also we had the public trust and confidence. The population had trust in professional bodies like NASU. Social workers, especially early career professionals, also realized they are on social media, they are also trusted in the community. So that was all the motivation for our intervention of using technology that we used to support communities. The approach was we identified participants, like how you can see, we identified over 200 active social workers. And also, we also had that orientation for them to understand the concept of advocacy and using online platforms. We also used the ESCO principles. We wanted that even though we are using technology, the social work principles, like a social ESCO use of technology and social media should be upheld, and also was one of the approach we integrated. NASU worked with selected social workers to develop and share posts every week on selected social media sites and linked to our system. We also had virtual guidance because as they shared, we realized that they needed guidance. For example, they could give us feedback, and also we continue guiding them on issues of children, on issues of family, on issues of confidentiality. NASU worked also in partnership to make this project a reality with ministries and institutions. And also the project was guided by principles of social work, like self-determination, which views the community as a catalyst of change, agent of change, target of change, and also an indispensable resource that the community itself consumes. Our advocacy also was in relation to International Federation of Social Work agenda of co-building with people, families, and communities. You realize that the struggle for COVID-19 fight went into community, and therefore wanted to empower the people, the social workers on front line, also to cascade the information. Also, when you look at our implementation process, NASU conducted weekly reflective meetings where we could engage with the participants, with younger people, younger social workers to give us the responses, and therefore we could also guide them accordingly. We came up with both weekly and also final report for this, which is also part of this presentation. When you look at the summary, that's how it was. We could identify social workers, orient them, we approve posts, and then they could be allowed to share them and then spark discussion online. You could see that there are different social media platforms that were used, like WhatsApp, like LinkedIn. There was also Twitter, and also social media platforms. So that was the approach we used and the model in summary. When you look at advocacy, this was online advocacy, and therefore we used online discussions and shares. Our belief was that the more the discussion is shared, the more is liked, the more the information has reached the community. So online discussions and shares, it promotes and model positive coping mechanism. For example, if the discussion was on prevention of COVID-19 and it is shared among many people, it means it is trying to help cope, to help the population cope very well with the disease. It also ended up creating an enabling environment for resilience, as you will see in our observations in the discussion. Those were some of the examples of the posts, of daily posts, the young people, young social workers used to make. And also we had a special day called the Info Friday. When you look at the post which is coming, there were some messages that were genuine. For example, when you look at Sauti 116, it is a toll-free line that we used to share, and that one could be shared on Fridays. And also the Ministry of Health also had guidance, like on what the signs of COVID-19. So we could guide them that all Fridays we could share the same information say from Ministry of Gender, like Sauti, or Ministry of Health. So in that, we realized that Info Friday sparked a lot of debate online and also likes. When you look at the summary down, it is a summary of what we did on one of the months, a sample of 1 month. For example, week 1 was on resilience amid COVID-19. You could see the likes and shares on Facebook, the likes and shares on WhatsApp, on Instagram, and also on Twitter. And also when you look on week 2, we are looking at protection of children against violence amid COVID-19 pandemic. These were the likes, shares, then on WhatsApp. These were the likes and shares on Instagram and also on Twitter. When you look at week 3, we are looking on safety measures in preventing the spread of COVID-19. Those were the likes, shares of WhatsApp, Instagram, and Twitter. When you look on the 4th week, we are looking at increasing community vigilance on measures to curb COVID-19. So the total for 1 month, you can see the total was 66,000 for Facebook only, 514 shares, 998. But as you can see up to the end, what we learned in these shares and also discussions online, that social media has that power of striking that discussion. From this point, let me invite Gerard to continue with the discussion.
Wow, thank you very much, John Mary. And friends, I want to believe that this is yet another season when we have come to realize the importance of social media and how things have really been working out for us as a globe generally. So sometimes we have a common saying that in the virtual world, you can reach certain countries before you even step into there. So I believe some of you from different countries have come to know John Mary, have come to know me, have come to know our IFS president, and a number of people in Joachim through, virtual interaction, and Mayaka, who is one of the coordinators in this conference. And of course, not forgetting Charles. But nonetheless, during this intervention, we're able to conduct 10 webinars as the Social Workers Association here in Uganda. And we covered different areas: child protection, mental health, community engagement, and COVID prevention strategies. And we were able to attract both local and international participants. We thank all those that joined us. We had online mentorship, where we had 102 frontline social workers. We were working remotely and we're supporting them via tele counseling and encouraging them, giving them information. We had some of our partners, and particularly in Western Uganda, where we were able to have home-based care. And we would wish to thank the team lead, that is Lydia, who is also one of our board members, who offered great help to over 30 people in Western Uganda. Unfortunately, one passed on. But as social workers, we believe that by the time someone passes on in the hands of a social worker, they've just rested. And we thank all of you that did that part. We supported over 5,000 Ugandans who were affected by COVID in quarantine centers, and we were able to work closely with the Ministry of Health, where we offered counselors to take part in the counseling sessions. As NASU, we discovered that, to continue serving our country much better, we needed to work with a number of ministries. It is during this season that our partnership with the Ministry of Health grew stronger, and also working alongside with our colleagues, the counselors, was also another bit that really helped us to advance. We worked closely with the famous Makerere University, where we came up with strategies on how to engage community. And we thank them so much because they've not let us, and we've not also let them go, because we have worked also closely in this season. And I wish to encourage even the other colleagues that are there, please, let's work together as institutions, as associations, and also as practitioners wherever we may be. Recently, as the National Association of Social Workers, we are glad that we co-hosted the Psycho Social Support Forum, which was also streaming live on the Facebook page of NASU and on a number of different platforms, mainly when they were hosting the Psychosocial Support forum that was across the region. We were able to present, we were able to share and get to learn different things that people needed to pick a leaf from. Our evaluation lessons and things that we picked, we discovered that young professionals have greater potential. And these guys are very amazing. I used to think that I was still young until when I gave the young people opportunity to do the online bit, and they were able to advance the campaign. As John Mary said, we discovered that even people trust them. They even trust their social media accounts. I remember in one of the webinars where we had with IFS Africa, I engaged with one of the ladies from IFS from Zambia, a very amazing young lady and very influential in the media area. That was so good. So we discovered that the youths, that the young professionals are not using the social media platforms lightly, but they're using to advance the social work agenda. They are very creative, and they were able to connect with their fellow youth in a number of areas. And we are glad that they are keeping the flag of social work up. We learned that community-led interventions in the fight against COVID-19 are more reliable and sustainable. Today here in Uganda, it's very rare to hear of a COVID-19 case. But even when it happens, we strengthen the system from the grassroots, and the teams are able to respond. The things of stigma, we're able to fight them as early as possible. And we came close, we worked together with the Ministry of Health, we worked together with all the stakeholders, and they were able to respect and advance. So the community has now taken charge, and with our support, because many of them that are down there, lack the professional touch. So we have social workers that are working alongside them in advancing this agenda. We learned that organizations need to mainstream young people in their programming to create significant and sustainable protection of children and families from stressors. Yes, the young people have interesting things, interesting new things to keep the children active. In Uganda, we are in November, schools are still closed except for universities that open, I think, this month. But we had almost spent over 2 years. But now, feel pity for the young children. I think it will be a good thing whenever young people get on board. I'll end here, but just to remind you, after this presentation by Ben, we are going to be having questions and answers, and we'll be live, ready to hear from you what questions you have for us. So over to you, Ben. Take us through. Ben?
Okay, thank you, Gerald and John Mary, for the introduction. I'm Seroma Ben, and I'm a social worker, and I work here at NASU Secretariat in Kampala, Uganda. We made a number of recommendations in line with the theme of the conference, that's Ubuntu. And one, we justified that our intervention was itself in the spirit of Ubuntu, because our project was supporting people who were vulnerable during COVID-19. That meant that we were not leaving the children, the families who were faced with a challenge of COVID-19. And in our intervention, we were still guided by the principles of social work, which relate closely with Ubuntu values. For example, when you talk about dignity and worth of the person, that implies that we are not leaving any other person, whether disabled, whether a child, whether an aged person. That means that our approach was all-inclusive, and we also ensured that the principle of human rights was at the center of our intervention, and that brings in the issue of humanity that we were trying to promote, the issue of rights. We also ensured social justice, that men and women, children and the young and the aged were also being targeted in order to create resiliences and fight the disease that had affected the whole world, and Uganda inclusive. We also, in our further recommendations, we say that in order to achieve more of the sustainable development goals, technology should be at the center, because during this COVID-19, we have learned that technology, as my colleague has said, can reach a big audience, and that can help us to cascade information that relates to achieving the sustainable development goals. We also recommend of strengthening of professional bodies, like the professional body in Kampala in Uganda. If it is strengthened, especially targeting the other professional careers, we can be able to expand social work services to every other person in our community. Finally, also recommended the need for to embrace technology as a new order, because of the limitations that were brought by COVID-19, moving from door to door or mobilizing big number of people was not possible, and thus a new paradigm of advocacy, of conducting trainings, of sending out information to big number of people. Technology done it better for us, and we recommend that technology can change the game of social work. We also believe that relationship created by young social workers in Uganda and the professional body exploited an opportunity where we can empower these young current professional social workers in trying to support the families, the children, and communities in case of any other global health catastrophe like the one of COVID, which we're experiencing. We also believe that going forward, social work needs to be at the center of all the work that we do, embracing each other, promoting fairness, justice to communities, because once we do that in our intervention, it means that the poor, the vulnerable people can also be reached at a greater scale. Ladies and gentlemen, I thank you.
Well, thank you very much, friends, for listening to us and joining us. For us as a team here in Uganda, I want to thank you so much. We are now ready to take up your questions, and we'll be glad to hear from you. Thank you very much.